Hello everyone, my name is Dr. Ray Butts, and I'm a physical therapist at Symmetry Physical Therapy. We're a concierge physical therapy practice in downtown Miami that offers one-on-one treatment with a doctor of physical therapy without the help of students, aides, or techs. I want to talk to you today about temporomandibular dysfunction, a condition that affects nearly half the population in some way, shape, or form. While many patients have given up on conservative treatment for this condition, I hope that you will take a second look after today's talk. Part of treating temporomandibular dysfunction is understanding the physiology of the condition. You have a number of chewing muscles, but there are only two muscles that are intimately related to the joint capsule itself: the superior and inferior head of the lateral pterygoid. As you can see in the pictures on the slide, the superior head is attached to the front of the interarticular disc and is responsible for keeping the disc in the right position as the mouth is closing. The inferior head, on the other hand, is responsible for moving the mandibular condyle forward as the mouth is opening. When you have degeneration or trauma or wear and tear of the joint, it typically occurs in the posterior aspect of the capsule itself, which is attached to the back end of the disc. This degeneration allows the articulating disc to slip forward from where it should be, rendering the superior head of the lateral pterygoid ineffective to track its position. As a result, the inferior head tries to compensate and becomes overworked, which leads to hypoxia, inflammatory factors, and trigger point formation. This leads to pain in both the joint itself and the chewing muscles. In addition, the mandibular branch of the trigeminal nerve is responsible for innervating the chewing muscles, and the cell bodies of this nerve overlap with the nerves that receive pain information from the upper neck. The research shows that many patients that have temporomandibular dysfunction also have upper neck issues and headaches, which seems to drive the hypertonicity of the muscles of mastication and further lead to pain. While looking at the occlusion of the joint itself can be an important aspect of treating temporomandibular dysfunction and has been extremely effective in some patients, this treatment paradigm remains controversial and can be very expensive. Here at Symmetry Physical Therapy, we have reviewed and published an article on the very best treatments of temporomandibular dysfunction conservatively. While the evidence for exercise, modalities, and posture control is limited, there is significant evidence for manual therapy to include mobilization of the temporomandibular joint itself, manipulation of the upper cervical spine, wind-back Tekar therapy, and electric dry needling. We actually recently published a paper on 120 patients with temporomandibular dysfunction and found that cervical manipulation and dry needling was superior to interocclusal splint therapy, prescription medicine, and temporomandibular joint mobilization. If you have temporomandibular dysfunction and you continue to struggle with this condition, I hope that you will consider coming to see us at Symmetry Physical Therapy. Let us show you that we can make a difference in your life and stop this terrible pain condition.